beautiful people. Bella Jamadisala here again. Welcome back to my YouTube channel. So today I'm talking about diabetes. Diabetes is one chronic illness that affects almost everyone, even though 60% of the world population. I mean, it affects a lot. Your skin color does not matter. When it comes to diabetes, it affects anybody, even an infant. A day-old baby, diabetes can affect elderly ones, young adults, teenagers. Mention that age, diabetes can affect anyone. And diabetes is a disease, a chronic illness that happens or occurs due to high sugar level in the blood. Now, today I'll be telling you the types of diabetes, explaining the type of diabetes, the symptoms, the causes of diabetes, and prevention, things that we can do to prevent it from happening. Now, the types of diabetes, don't mind me if I'm scrolling through my books, I'll be glancing through a little bit. So, the first type of diabetes I'd like to talk about today is type 1 diabetes. Type 1 diabetes is a chronic condition which it occurs when the pancreas produces little or no insulin. So the second type of diabetes I would like to talk about today is type 2 diabetes. This is a chronic condition that affects the way the body processes blood sugar, that is glucose. Now, we also have gestational diabetes. This is a form of high sugar level that affects pregnant women, that it occurs during pregnancy and usually goes away after delivery. Now, pre-diabetes, this is like borderline diabetes, when your sugar level is always on the high side, but at the same time, you're not yet diabetic. At this stage, you have to take caution. If not, you could become a diabetic patient. Now, another type or cause of diabetes is neonatal. This is a rare form of diabetes that occurs within the first 6 months of one's life. I mean, from age 0 to 6 months. Now, this kind of diabetes actually goes away over time, but it can also reoccur later on in future. Now, another kind of diabetes is maturity onset diabetes of the young. It's called MODY, and this is a genetic mutation that affects how your body produces and uses insulin. You get that? Now, another type of diabetes is latent autoimmune diabetes. Now, autoimmune diabetes, as the name says, is an autoimmune reaction, and it affects mostly people from age 30 above. And lastly, the last type of diabetes I would like to talk about today is type 3C diabetes. Type 3C diabetes occurs when your pancreas experiences damages. So when the pancreas now experiences damages, it makes it incapable of producing insulin that can process our sugar or glucose, hence causing diabetes. So now, symptoms of diabetes. One thing that you should keep in mind before I start saying these symptoms is that most of these symptoms can actually be as a result of another illness entirely. So because you have most of these symptoms, you're experiencing majority, does not mean you are diabetic, and does not mean you start self-medicating. You have to confirm if you are diabetic before you start using drugs, because low blood sugar too can be very, very dangerous. Now, some of the symptoms are fatigue, frequent urination, blurred vision, increased thirst, dry mouth, unexplained weight loss, slow healing sores or cuts, frequent skin irritation, or numbness or tingling of your hands and feet. Now, there are some complications that occurs during diabetes. When you have diabetes or when you're diabetic, some of the complications are hyperglycemic state. This is the situation where your blood sugar is increased for a very long period of time, and it can cause severe dehydration or confusion. Now, another complication that can occur when someone is diabetic and when it's not properly managed is hypoglycemic state. This is like the opposite of hyperglycemic state. Hypoglycemic simply means when your blood sugar level is low for a long period of time and can cause clumsiness, disorientation, blood or double vision, and even seizure. Yes, it can actually cause seizure. Other complications that can occur when you have diabetes or when you're a diabetic patient are coronary heart disease, heart attack, stroke, neuropathy, which is nerve damage, nephropathy, which can lead to kidney failure, and retinopathy, which can cause blindness, sexual dysfunction. For men, erectile dysfunction. Why for women? Like lack of, you don't have any sexual urge. At the same time, you experience severe vaginal dryness. Then other complications are hearing loss, skin irritation. Now, there's one known fact. People with diabetes are 3 times prone to get depression, to get depressed, to actually have depression. Mainly, most people battling with serious health challenges are prone to depression because a lot of the complications that come with these health challenges, the baggages that come with it alone can make someone depressed, can make you really, really sad. So when you know you have any issue, it's not a death sentence, yes, because once you do some certain things that you're supposed to do, you monitor it, you obey the rules and regulation that comes with whatever illness you have, you will live as long as you can. Now, managing diabetes. There are 4 major things that you have to know when you are a diabetic patient or you have diabetes, irrespective of the age. The first thing is monitoring your blood sugar level. As a diabetic patient, there's number one thing that you should know, that you get that machine in your house. It's self-explanatory. If you don't know how to use it, wherever you're purchasing the machine from, or you take it to the hospital, they will explain to you how to use it. You don't have to find a pharmacy around you, an hospital around you before you monitor it. If you are diabetic, you must check your sugar level at least 3 times in a week. Nothing less than 3 times in a week. It's just like someone that has high blood pressure. Checking your blood pressure is very, very important. Though if you're not diabetic or hypertensive, you need to still check this in at least once in a week. The fact that diabetes can affect an infant, a day-old baby, it means nobody is exempted from this. The second thing that you need to know when you are diabetic is using your prescribed medication. Whether you're using orthodox medicines or herbal medicines, you must use your medications. Some people will say, hey, I've gone for deliverance. Yes, God created these doctors or naturopaths for us. He gave them that wisdom to produce these things to work for us. You say you're not feeling symptoms anymore. The main reason why you're not feeling those symptoms or having those complications is because you've been using your medications. So stopping your medications can actually be very detrimental to your health. You know, when you are hypoglycemic, when you have very low blood sugar, it can lead to seizure, in fact, blindness, disorientation, and hyperglycemic can actually lead to double or blood vision or even blindness. So if you don't want to be blind or amputated, because when your sores or your injury does not heal, it can actually lead to amputation before you become septic or you fall into septic shock. So make sure you use your prescribed medications the way it has been prescribed to you. Don't say it is too high, so let me double the dose. Never double your dose yourself. Never alter your dosage yourself. Make sure it is done by whoever prescribes the drug for you. Now, the third thing you must keep in mind is your diet. So every human, whether it's young or old, must watch what they eat. See, living healthy is the goal now. Eating all these junks and all does not get anybody anywhere. In fact, it adds more problems and more baggages to our lives. So why not try living healthy? Change your diet. There's some things you have to stop eating when you're diabetic. Yes. Why? There's some things you have to cut back on. See, those things you're supposed to stop, you stop it. Those things you're supposed to cut back on, you cut back on them. And you see those veggies and fruits you're supposed to take, you take them the way you should take them. Do you know there are some fruits that some diabetic patients can take, like pineapple, because it is naturally sweet, and dates. So there are some things you have to know, and you cannot know them by just going on Google. You have to go to a certified nutritionist or a doctor or someone that can actually put you through. Google can actually mess you up sometimes. And lastly, exercise. It doesn't have to be strenuous. It just has to be very, very light. Maybe taking a walk, taking a walk, jogging, doing some house chores here and there, just to burn out the glucose, burn out, you understand? Burn out these things from your body so your body does not accumulate them. It is very important and it is very essential. Now, prevention. For those of us that are not diabetic yet, whether you have children can get it too. So this is not just for adults, for children also, for teenagers, elderly ones, whatever age. It's for everybody, infants, children, pregnant women, elderly ones, teenagers, anybody. So this prevention is not just for adults, it's for everybody. Healthy diet, that's number one. Your diet must be very healthy. There is nothing like it is too expensive or it is stressful, I don't have time. You have to find time. Because diabetes is a lifetime sentence, so you can manage it, you can get rid of it, probably by luck or by chance it can go, but it could be a lifetime sentence. Meaning you'll be on drugs for the rest of your life. So if there's a way for you to get out of this thing, I think it's a safe thing or a wise thing to say that you should take this, you should follow these measures. Healthy diet, physical activities, weight control, monitor your weight. Monitor your weight. Then stress management. Let's learn how to manage our stress. Learn how to delegate things. So if you're a CEO or you're a boss somewhere, a manager or something, learn how to delegate. You can't do everything. You're a chef, you cook, a fashion designer, whatever. Just learn how to delegate your work to your workers. Learn how to give out instructions. Don't do everything yourself. Learn how to manage your stress. Now, limit your alcohol intake. Drastically alcohol, glucose. It's just biscuits. Most of them are made from barley, yeast, and thereabouts. Most of them are carbohydrate that still converts to glucose, so it can cause diabetes. Too much of alcohol intake. It's not just soda or caffeinated drinks that can cause diabetes. Alcohol too can. Then sleep well. Most of us don't sleep well. The country is hard. This is happening. That is. If you don't have sound health, the career you are trying to pursue, it's just going to be, I don't know, a loss because you won't be able to do anything. Somebody else will be managing it for you. But when you have sound health, when you're able to manage your stress, where you're sleeping well, you're following the things you're supposed to do, you manage it very well, efficiently self. Just learn how to manage your time management. So you know when to sleep, when to rest, when to walk, when to eat well, and all those things. Quit smoking. This one is not about managing how to smoke. You have to stop smoking completely. Shisha, vape pen is also smoking. Cigarette, weed is smoking. Quit smoking. No limit. Quit smoking. And lastly, monitor your blood sugar level. You are not diabetic yet, but at least once in a week or at least once in 2 weeks, monitor your sugar level. Thank you guys for listening. I hope you enjoyed today's topic. Do not forget to subscribe, share, like, and drop your comment. Bye-bye.